Hello, good afternoon. I'm Dr. Sneha Bhagwat, and as we all know, today we are almost in a medical emergency with the second wave that has come up. The second wave is the second double mutated strain which has come from Brazilian, African, and UK origin. During the second wave, what we can expect and how really we can look at it and how we can protect ourselves from getting infected and how we can fight it out. This is very, very important because in a pandemic like this, I think that there are three things which have to come together and work. The first one is definitely the government, the system, and the policies that the government is making. The second is the healthcare infrastructure, the doctors, the medical, paramedical staff, the sanitization workers, and third is we ourselves as citizens. So the government is doing their own bit and own contribution to control the surge of this second wave, trying the level best. We have seen all the COVID care centers are reopened. The doctors are definitely overloaded, overwhelmed, and doing their best to give the best facilities possible, to give the best treatment possible and help the public as much as possible to fight out this COVID pandemic. But what about us? I think you as citizens should also do our bit, and this is a larger section of the bit, not the small thing. So let us first understand that this second wave of COVID-19 infection has a little different symptoms than the previous COVID-19 infection. Like the earlier first wave, which we had last year, was having symptoms like cough, cold, throat irritation, and fever and loss of smell. Whereas now the symptoms are quite a bit different, and they include vomiting, stomach upset, loose motions, even small symptom like heaviness in the head or headache, fever which rises up to 101 and above, continuous productive cough, and feeling of weakness, fatigue are also symptoms of second wave of COVID infection. The gold standard that we have to understand whether we are positive or no, the gold standard test is as of now RT-PCR. That is the most trusted test. But with the second wave, it is also seen that 1 out of 5 patients come as false negative, and this also can lead to more infections. So as soon as we see the symptoms, we go and test ourselves. After we come back home, until we get the results, it is important that we isolate ourselves. It is important that we suspect and predict that we are positive, and accordingly we take care of ourselves. What care should we take when we know about these symptoms, when we actually experience these symptoms? So we have to first of all start wearing the mask, which is very much necessary when we are going outside. But when we know that we are having the symptoms at home also, we need to wear masks so that our family members are protected. We need to isolate ourselves until we get the test results. It may take, because of the continuous rise in infections, it may take even 2 to 3 days for the results to come to us. So until then, we have to have patience, calm, keep ourselves calm, start taking our regular medicines like vitamin C, vitamin D, Zincovate, and continue with all the possible immunity increasing measures. Also, along with that, consult your regular physician who is in touch with you, otherwise like a family doctor. Tell your symptoms when you're talking to your doctor. If the physician is not known, or if your physician doesn't know who you are, you're not his regular patient, you need to give complete details to your doctor. The complete details means you need to tell the doctor that about your age, about your physique, whether you are obese, thin, overweight, whether you have been having any kind of problems like diabetes, hypertension, renal failures, or heart attacks, or if you have been having any kind of a strong infection recently, if you are allergic to any medicine, if you have undergone any surgery recently, all these details have to be mentioned completely without any hesitance to your doctor, so that the doctor knows which medicines to give you and what care should be taken. Once you understand that you're positive, think that your family members also are positive. So you have to again send your family members for testing and isolate the whole family so that they do not go out and spread the infection. Because the second wave of infection which is come, it is seen that one person who has been infected, even though he is asymptomatic or mildly symptomatic, he can pass on the infection within 15 minutes to the next person. So if you are in touch with the infected person even for 10 to 15 minutes, there are chances that this droplet infection is passed forward to other people. So to avoid all these unwanted spread of infection, we need to isolate ourselves and isolate our family once we know that we have such symptoms. After this, try and focus, be calm. Getting panic is really not the way out to overcome this COVID infection. COVID infection can come to you, but that doesn't mean it is fatal or it will land you into an hospital. If you start the treatment from day one, if you are careful about your diet and your lifestyle, definitely you can fight it out better and smoother. So from day one, try to follow your diet. The diet should include more of plant-based protein, more of fresh but cooked and boiled vegetables, more of healthy food, no junk food, no kind of fresh fruits, because we know fresh fruits create phlegm. Instead of that, you can have black raisins, which is rich in vitamin C, which is rich in folic acid, so that will help you to boost up your immune system. Remain hydrated, have coconut water, because now the season is hot, so try to keep yourself hydrated. Weakness also is one of the major symptom in the second wave. Also, do not have any junk food, any kind of fried items, pickles, papads. All this should be out of your food for at least 10 to 14 days. Do not also have any kind of milk products, because milk products, all this rich food actually stresses your metabolic system. Your digestive system and the metabolism gets slower, so automatically the viral load increases and the infection progresses. So try and keep yourself light. You can have your food in intervals as you are going to be at home, but it should be nutritious food. The third thing which you need to follow is about oxygen saturation. Keep up the track record of your oxygen saturation regularly. Once you register yourself on government portal, you will definitely get a kit and a chart. So you have to maintain this chart. On this chart, every day, morning, afternoon, evening, you have to mention you have to write down and keep a record of your oxygen saturation levels. This is very important, especially on the third or fifth day. Watch yourself if you're having any kind of productive cough, or if your oxygen saturation level is coming down, immediately inform the doctor. There is also another way to find out how far you're progressing. So after 3 to 5 days, walk. It's called as a 6-minute walk test. So you have to walk for 6 minutes in the house itself and then check your oxygen saturation. So if this oxygen saturation level is below the normal level which you had earlier by 5 to 10%, it is an alarming sign. So inform the doctor immediately. As well, suppose if your test result is negative, but still if you have symptoms, then definitely there are other tests that can recognize whether you are really positive, and those tests are something like CRP, reactive protein, or HRCT, but these tests also have to be done under only the guidance of a medical professional. You can if you are mild symptomatic or asymptomatic, or as soon as you know that you are positive, you can opt for any kind of medicine. You can take Ayurvedic medicine, you can take a normal regular allopathy medicine, but you have to do it as soon as possible. Ayurvedic medicines also are there, but you have to take it from a registered medical practitioner only. The WhatsApp university and the social media university is not going to help you at all. Do not fall prey to this something called as infodemic. Try and understand that these messages are not spread by doctors, but they are spread by some people who know a little bit about home remedies or herbal remedies, and they just keep spreading these messages like, you can smell this, you can have this kada, but this may not help you really in treating the disease. It may somehow help you in improving your immune system, but once you are tested positive, you have to definitely consult a proper doctor or a medical professional. Once you are tested positive, it doesn't mean that you need to be in the hospital or you need to land yourself in the hospital. You can get cured by being at home, by being at ease, being in a calm, nice way. So you can practice pranayam, breathing exercises, which will help to improve your oxygen levels, to not engage yourselves in any kind of strenuous or stressful or overburdening exercises, physical exercises for your body. You should understand that you need rest during this time. Do not also go to sleep during the day, because that also slows down your metabolic rate and it can again increase the viral load. So if you are feeling weak or fatigue, of course you can sleep, but do not sleep just after having food and your stomach is full. Along with this, it is important that whenever somebody calls us or tries to know about us, give a proper information. Do not spread that, okay, I have done this and this has helped, so that there is no confusion. Then people who have been good, who are not yet tested positive and who are above the age of 45, please go and get yourselves vaccinated, so that vaccines help us not to increase the fatality rate, so that the fatality rate comes down. It will also help us to minimize the medical emergencies, to minimize the load on the medical system, and also save yourselves so that you have a faster and better recovery rate. People who have got symptoms after taking first vaccine can get definitely symptoms. There could be infections. Vaccines doesn't mean that you will not get infected, but definitely the infections will be much more milder. So my dear friends, along with this, one more request: do not go outside unless it is very, very, very much necessary. Wear masks at all times, sanitize yourselves, wash hands, keep following the regular Covid-19 protocols, which are very much necessary. And one more challenge today I would like to give you, that is the Mask on Goa challenge, means MOG. We all know that we Goans are very much known for our lovely nature, for our kindness, for our kind-hearted gesture that we have of helping others. So let us continue this gesture and take up this challenge of Mask on Goa. I take this challenge and I appeal to you also to take up this challenge. Let us act smartly, be safe and be strong, so that we share this and protect ourselves and protect our people amongst us. Thank you very much.